general medical conditions, common infectious diseases, the muscular system disorders, and nervous system disorders. Duchenne muscular dystrophy. This is a hereditary condition causing degeneration of the skeletal muscle, which is gradually replacement of the muscle with adipose and connective tissue, which leads to a decreased circulation that perpetuates the condition. Common signs and symptoms in children, it is exhibited by frequent falls and difficulty standing. Muscles tend to shorten as they atrophy, which causes scoliosis and other postural abnormalities. Muscular dystrophy cannot be cured. Consistent exercise can be used to slow down atrophy. It is common for patients to have to ambulate or move around with braces until the individual is confined, eventually to a wheelchair. Myasthenia gravis. This is an autoimmune disease where the antibodies attack the synaptic junctions. There is a deficiency in acetylcholine, which produces early fatigue. This often occurs in females aged 20 to 40 years of age. Signs and symptoms include drooping of the upper eyelids and double vision due to weakness in the extraocular muscles. There is a difficulty chewing and swallowing, weakness in the extremities, and a general decrease in muscular endurance. We manage this condition by treating it with drugs that inhibit the breakdown of acetylcholine. Corticosteroids can be used to suppress the immune system, thus reducing the production of antibodies that destroy acetylcholine receptors. Multiple sclerosis, also known as MS. This is an autoimmune inflammatory disease of the central nervous system that causes deterioration and damage to myelin sheaths, ultimately disrupting nerve conduction. Signs and symptoms include blurred vision, speech deficits, tremors, muscle weakness, and numbness in the extremities. Tremors, spasticity, and mood swings are common. Typically, this condition can progress slowly, or it may be an acute attack followed by partial or complete temporary remission. We deal with symptoms as they occur. There's no cure for multiple sclerosis. Avoid overexertion, extreme temperatures, and stressful situations. It is important for the individual to establish an exercise routine to maintain muscle tone. Drug therapies can slow the progression of multiple sclerosis. Chronic fatigue syndrome. This is a disease characterized by profound fatigue, sleep abnormalities, pain, and other symptoms that are made worse by exertion. Chronic fatigue syndrome occurs more commonly in women. The cause of this condition is unknown, but may include environmental or genetic factors. The main symptom is fatigue for over 6 months. The fatigue often worsens with activity, but does not improve with rest. There is no cure or approved treatment for this condition. However, some symptoms can be treated or managed to provide the patient with relief. Amyotrophic lateral sclerosis, also known as ALS. This is commonly known as Lou Gehrig's disease as well. This is a sclerosis of the lateral regions of the spinal cord, along with degeneration of the motor neurons and significant atrophy. Signs and symptoms include difficulty in speaking, swallowing, and use of the hands. The sensory and intellectual function of the individual remains intact. There is a rapid progression of atrophy, resulting ultimately in paralysis. There is no cure for ALS. Even after incapacitation, normal intellectual function remains. 2 famous individuals, Lou Gehrig and Stephen Hawking, have ALS. Complex regional pain syndrome, CPRS. The etiology is abnormal and excessive response of the sympathetic portion of the autonomic nervous system following injury. This may be referred to as a reflex sympathetic dystrophy, RSD, or causalgia. CPRS is commonly seen in the hands and feet following immobilization of an injured part, associated with bone, connective tissue, blood vessels, and nerves. The development of extreme hypersensitivity to touch, redness, sweating, burning pain, swelling with palpable tightness, and shiny skin. The individual will likely have atrophy of that area as well. There may be an associated psychological depression that occurs at the same time. To treat complex regional pain syndrome, early recognition and intervention is critical. Most direct treatment is targeted at disrupting abnormal sympathetic responses. The use of a sympathetic ganglion nerve block is critical. Active range of motion exercises through a pain-free range of motion and the use of modalities to modify pain and reduce swelling can be helpful. Antidepressant drugs may be necessary for chronic conditions. Blood and lymph disorders, iron deficiency anemia. This is prevalent among menstruating women and males ages 7 to 14 years. Three things typically occur during anemia. We see small erythrocytes, decreased hemoglobin, and low ferritin concentration. Ferritin is a compound that contains 23% iron. Gastrointestinal loss of iron in runners is common. Aspirin and NSAIDs may cause GI blood loss. Menstruation accounts for the largest iron loss in women, or individuals who follow a vegan or vegetarian lifestyle may lack iron from the foods they eat. The management is to eat a proper diet, including more red meat or dark poultry. Pairing food groups can definitely help someone of a vegetarian or vegan lifestyle add more iron into their diet. Avoid coffee and tea. This hampers iron absorption. Consume vitamin C. Vitamin C can enhance iron absorption. And we can also encourage individuals to take iron supplements, but this largely depends upon the degree of the iron deficiency anemia. Iron deficiency anemia, signs and symptoms. The first stage of deficiency, performance declines. The patient may experience burning in the thighs and nausea from becoming anaerobic. Ice cravings are common. Serum ferritin levels must be assessed. Mean volume and the relative size of erythrocytes must also be checked. Runner's anemia. This is also known as heel strike hemolysis. This is caused by the impact of the foot as it strikes a surface. We see this most commonly in runners as their feet are hitting the pavement. The impact destroys normal erythrocytes within the vascular system. Signs and symptoms include mildly enlarged cells, increase in circulatory reticulocytes, and decrease in haptoglobin bound to hemoglobin. The amount of damage varies according to the amount of running the individual has done. The management, we try to reduce running distance. If bleeding occurs, the patient or athlete should be taken to a medical care facility. There is no cure, so we must treat the symptoms. Clotting factors have been developed to control bleeding for several days. Patients should be instructed to avoid trauma and wear a medical alert bracelet. Sickle cell anemia. This is a hereditary hemolytic anemia. The red blood cells are sickle or crescent shaped and result in irregularly shaped hemoglobin. This change in shape decreases the ability of the hemoglobin to carry oxygen, and it limits the ability of the hemoglobin to pass through vessels, which may cause clustering and clogging of the vessels. This is sometimes known as a thrombi. Death can result if an embolus develops and travels to the lungs. Exercise factors that can cause sickle cell anemia: acidosis, hyperethemia, dehydration of red blood cells, and severe hypoxemia. This can be brought on by exposure to high altitudes as well. Signs and symptoms of sickle cell anemia include fever, pallor, which is a whitening or blanching of the skin, muscle weakness, and pain in the limbs. Pain in the upper left quadrant indicates possible splenic infarction. Headaches and convulsions are also possible. The management for sickle cell anemia is to provide anticoagulants and analgesics for pain. These individuals should be monitored carefully during exercise for what is known as a sickling event. Hemophilia. This is a hereditary disease caused by deficiency of clotting factors. This can result in prolonged coagulation time, failure of the blood to clot, and abnormal bleeding. Signs and symptoms include physical exertion can cause bleeding into muscles and joints, which then can become extremely painful. Joints may become immobilized with the amount of blood This can be a deadly condition, so individuals should be immediately referred to an emergency care facility. Lymphangitis. Lymphangitis. This is an inflammation of the lymphatic channels caused by a bacterial infection. Signs and symptoms usually occur in the extremities. There is deep reddening of the skin, warmth, inflammation in the lymphatic tract, and raised borders over the affected area, particularly in the case of an infection. Chills and high fever with moderate pain and swelling are noted. Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar, called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body's cells for use as energy. If an individual has diabetes, their body either does not make enough insulin or cannot use the insulin it makes as well as it should. When there is not enough insulin, or cells stop responding to insulin, too much blood sugar stays in the bloodstream. Over time, that can cause a serious health problem, such as heart disease, vision loss, and kidney disease. To date, there is no cure yet for diabetes, but losing weight, eating healthy food, and being physically active can really help. Taking medications as needed and keeping healthcare appointments can also reduce the impact of diabetes on an individual's life. 37.3 million United States adults have diabetes, and 1 in 5 of them do not know that they have it. Diabetes is the 7th leading cause of death in the United States. And diabetes is the number 1 cause of kidney failure, lower limb amputations, and adult blindness. In the last 20 years, the number of adults diagnosed with diabetes has more than doubled. There are different types of diabetes that we will discuss. It is important to understand the underlying cause and potential treatment for the diabetes condition. Type 1 diabetes is thought to be caused by an autoimmune reaction, the body attacking itself by mistake, that stops your body from making insulin. Approximately 5 to 10% of individuals who have diabetes have type 1. Symptoms of type 1 diabetes often develop quickly. It is usually diagnosed in children, teens, and even young adults. If an individual has type 1 diabetes, they will need to take insulin every day to survive. Currently, no one knows how to prevent type 1 diabetes. Type 2 diabetes. With type 2 diabetes, your body does not use insulin well, and it cannot keep blood sugar at normal levels. About 90 to 95% of people with diabetes have type 2. This develops over many years and is usually diagnosed in adults, but more and more in children, teens, and even young adults. An individual may not notice any symptoms, so it is important to have blood sugar levels tested if individuals are at risk. Type 2 diabetes can be prevented or delayed with healthy lifestyle changes, such as losing weight, eating healthy food, and being physically active. Gestational diabetes develops in pregnant women who have never had diabetes. If an individual has gestational diabetes, the baby could be at higher risk for health problems. Gestational diabetes usually goes away after a baby is born, but increases the mother's risk for type 2 diabetes later in life. The baby is also more likely to have obesity as a child or teen, and just like the mother, is more likely to develop type 2 diabetes later in life. Prediabetes. In the United States, 96 million adults, more than 1 in 3, have prediabetes. Even more concerning is 9 out of 10 people with prediabetes do not even know that they have it. With prediabetes, blood sugar levels are higher than normal, but are not high enough to yet be diagnosed as type 2 diabetes. Prediabetes raises the risk for type 2 diabetes, heart disease, and even stroke. The good news is that if an individual knows that they have prediabetes, lifestyle changes can help an individual make healthy steps to reverse it. The thyroid gland is an endocrine gland that lies anterior to the trachea in the neck. It is responsible for the synthesis of thyroxine and triiodithyronine. Reactions which are stimulated by the thyroid-stimulating hormone in the anterior pituitary gland. To palpate the thyroid gland, palpate along the anterior aspect of the neck. Adults do not typically have a palpable thyroid gland unless there is a condition. Hyperthyroidism is an overproduction of a hormone by the butterfly-shaped gland in the neck called the thyroid. Hyperthyroidism is the production of too much thyroxine hormone. This can result in an increase in metabolism. Symptoms include unexpected weight loss, rapid or irregular heartbeat, sweating, and irritability, although the elderly often experience no symptoms. Treatment may include radioactive iodine, medications, and sometimes surgery. Hypothyroidism is a condition in which the thyroid gland does not produce enough thyroid hormone. Of the thyroid hormones can disrupt things such as heart rate, body temperature, and all aspects of metabolism. Hypothyroidism is most prevalent in older women. Major symptoms include fatigue, cold sensitivity, constipation, dry skin, and unexplained weight gain. Treatment consists of thyroid hormone replacement. Seizure disorder and epilepsy. A seizure is caused by an abnormal discharge of electrical activity in the brain. The outward manifestation of a seizure is altered awareness, involuntary movements, or convulsions. This may occur as a result of brain injury or insult, heat stroke, hypoglycemia, hyponatremia, alcohol consumption, or drug withdrawal. Epilepsy is a chronic condition consisting of unprovoked, randomly occurring seizures. Seizures are abnormal movements or behaviors due to unusual electrical activity in the brain. They are a symptom of epilepsy, but not all people who appear to have seizures have epilepsy. There are a group of related disorders characterized by the tendency for recurrent seizures. In the event that someone suffers from a seizure, providing first aid is key. Cushion the head and remove the individual's glasses. Loosen any tight clothing. Turn the individual on the side. You do not have to restrict them if they are seizing. This is a good recovery position. Time the seizure with a watch. Do not put anything in the individual's mouth. Look for a medical ID bracelet. Do not hold down or restrict the person. As the seizure ends, offer help. Hypertension is a condition in which the force of the blood against the arterial walls is too high. Usually, hypertension is defined as a blood pressure above 140/90 and is considered severe if the pressure goes above 180/120. High blood pressure often has no symptoms. Over time, if left untreated, it can cause other health conditions such as heart disease and stroke. Eating a healthier diet with less salt, exercising regularly, and taking medications can help to lower blood pressure. Primary hypertension accounts for 90% of all cases with no other disease association. Secondary hypertension is associated with kidney disorder, overactive adrenal glands, hormone-producing tumors, narrowing of the aorta, pregnancy, and other medications. Long-term cases of hypertension increase the chances of premature mortality and morbidity due to coronary artery disease, congestive heart failure, and stroke. Primary hypertension is generally asymptomatic until complications arise. When complications do arise, hypertension may cause dizziness, a flushed appearance, headache, fatigue, epistaxis, which is a nosebleed, and nervousness. A thorough examination must be performed to determine the type of hypertension and the extent of hypertension. Medication is generally not recommended for those with prehypertension, 120/139/80/89, unless it is linked with other conditions. If prehypertension is an issue, lifestyle changes should be made. Individuals with stage 1 and stage 2 hypertension should be medicated. Cancer. This is a condition where cellular activity becomes abnormal and cells no longer perform normal function. Cells do not multiply at increased rates, but continue to develop, ultimately taking over normal tissue. Tumors may be benign or malignant. Malignancies are classified based on the types of tissues they invade. There are a variety of causes of cancer, including ultraviolet radiation, chemicals such as tobacco and alcohol, fatty diets, and a combination of hereditary and environmental factors. The signs and symptoms of cancer vary tremendously depending upon the type of cancer. Warning signs generally include changes in bowel and bladder habits, sore throat that does not heal, unusual bleeding or discharge, development of a lump in the breast or elsewhere in the body, indigestion, and a change in a wart or mole. Early detection for cancer is critical. There are effective forms of treatment, including surgery, radiation, and chemotherapy.